BizTech's Health and Wellness Show, where we focus on equipping you with knowledge on health and wellness to help to ensure a more productive and healthy lifestyle for yourselves, your families, and your employees. Now, the conversation today is about mental health and your heart, and this presenting and content partnership is together with Institut Jantung Negara, the National Heart Institute of Malaysia. Now, to bring an expert lens to this topic, we have Dr. Iskandar Mirza Shafie, the Clinical Fellow of Cardiology at the Institut Jantung Malaysia, which is Malaysia's National Heart Institute. Now, Dr. Iskandar, welcome to the show.
Thank you. Thank you very much.
Now, Doc, can you start by giving us an overview of your background and also your training?
Okay. Actually, I start my undergraduate under UiTM MBBS, and then I pursue my specialty in MRCP in Ireland. And then after that, so I completed my gazettement under Hospital Kuala Pilah previously for 2 years, and currently I'm in IJN to further my studies under cardiology. And currently I'm a cardiology trainee under Institut Jantung Negara.
Okay, so what inspired you to become a doctor, and particularly what inspired you to focus on cardiology?
Okay, actually, what inspired me to become a doctor, because actually since I was young, actually I have this tendency to I really like to see people, doctors in the television treating other people. It's quite interesting because how people can help to heal other people, to make them recover from injury or illness. So since then, since my childhood, actually I really like to become a doctor. But why I choose cardiology? Actually, previously when I was a medical officer in Hospital Putrajaya, actually I really like to see this electrocardiogram. This is one of the tests to see the heart rhythm. So I have really a major interest in seeing the electrocardiogram, or we call it ECG. And then since then, actually my interest become more deeper and deeper into cardiology. So I hope one day I can actually proceed with another subspecialty, because actually medical is a never-ending study. You keep on studying.
Yes.
Okay, I don't know when we're going to stop. So actually, hopefully one day I'm going to do a small subspecialty under cardiology.
What subspecialty is that?
It's either intervention. Intervention is the one that do angiogram, and also angioplasty, or another one is electrophysiologist. Electrophysiologist is under heart rhythm specialty.
Okay, that's interesting. Now, I want to zoom back on our challenges in terms of mental health. Now, in the past in Malaysia and in fact most of Asia, mental health is really very much a taboo subject. Yes. But now it is a subject that is much more widely discussed because of the pandemic. Mm-hmm. But interestingly enough, Doc, it may be common to you, but it is very rarely discussed in the context of heart disease. Can you kind of enlighten us on the connection between mental health disorders and heart disease?
Okay, so mental health and heart disease actually have role in between. Actually, both can cause each other. Mental health can cause heart disease also can cause mental health. So first we go to the mental heart disease causing mental health. For those who have heart disease, when you have weakened heart either from heart attack, or actually some people just have weakened heart, but they don't know why it's really cause of the weakened heart. So when you have a weakened heart, actually the capacity for the heart to pump become very low. So when the oxygen that needs to supply to the organ by the heart can't be met, so actually the patient actually can have low mood. Because the brain not enough oxygen supplied by the heart, and then sometimes they cannot move around. Previously they can actually do sports, recreational activity, or sometimes to do sexual intercourse also can be limited because of the heart problems. So all these problems can cause actually mental health. They can cause depression, because all that they can do previously they can't do anymore. Okay. Unless we give some intervention. While the others, the other topic is about the mental health that causing heart problems. This is very common. Okay, so some people have a very high stress burden, from the work, from house, from family, and then from friends. Because now we know that the most common stress causing now is from social media. Actually, cyberbullying is also very common nowadays. So all this actually can cause actually depression. So when it causes depression, actually those who depressed, can I ask you, Brian, if you are depressed, what would you do, Brian?
Okay, good question, Doc.
Ah.
And I think that if I was depressed, and unfortunately I have a strong mental disposition, I will first call something like Befrienders to get help, because you need to call a helpline or something like that to kind of get help.
Okay.
You also sometimes will, if you are, if let's say I'm depressed or anxious, the easiest thing to do is to talk to somebody that's close to you, or maybe sometimes not too close to you, but somebody who's perhaps gone through some experiences before that is able to share something with you.
Yeah, that's right. That's very good because you still can think correctly, Brian. Okay, but some people actually the stress piling up every day, piling up, so they sometimes they cannot handle. So what happens for those who have this persistent stress? They start to feel useless. So this is a problem. When they start feel useless, they won't adapt a healthy lifestyle. Okay, they start eating junk food. The most easiest to find is junk food. Of course, fast food. And so fast food, processed food. And then sometimes they heard from other people that smoking does reduce the stress. So they start smoking. So, and then all these habits can cause high cholesterol, and also smoking can cause heart attack. So that's why this kind of patient, there's a risk. Not only that, when you are persistent stress, your stress hormone will become piling up from the body, is causing your heart to pump faster compared to other people. So all these hormones actually can cause heart attack if persistently high over weeks or months. So that's why this kind of group of people who is having persistent stress, actually they can have heart attack because of the lifestyle changes that they will go through when they have stress.
Doc, this is a very interesting comment that you've made, because I've personally seen that, especially in the corporate environment, we see this all the time. People are under stress. They have to spend longer hours at work. They start to put on weight. Yes. They don't do exercise. Yeah, interesting. Now I'm thinking about it when you say about picking up smoking. Suddenly, somebody in their 40s, hey, all of a sudden they picked up smoking. Or they used to be casual smoker, maybe occasional, and then they become heavy smokers. So suddenly then they get into that high risk profile for heart disorders.
Yeah, that's right. There's a problem with stress. So another thing is sometimes for those who drink alcohol also, actually they become from occasional drinker become a regular drinker. Too many alcohol is very bad for your heart, because actually there's a lot of it can actually can damage your heart from the alcohol intoxication. So that's why actually all these effects, not only from the food, from the exercise activity, smoking, and also the hormones inside the body. So there's a multifactorial that can actually precipitate the heart attack for this kind of patient.
Okay, now can I ask you then, if you could break it down, what groups have higher rates of heart disease from mental health disorders?
Okay, those who have anxiety have the lesser risk. Anxiety, because sometimes because anxiety is very limited. It's not persistent. They only have it suddenly, but they don't know what is the cause. So after that, they can think clearly afterward. But the one who is gonna really affected is for those who have either bipolar or depression. Those who have depression is the most highest because they have low mood. When they have low mood, even though that even like if you have a friend now having a depression, you give a mental support, you give a moral support to them, they still can't actually accept what you say, because they're in low mood. That's why some patients with depression, friends doesn't help that much. They need a professional's help. Sometimes they need some medication or some psychotherapy that can actually make them understand that what they're doing right now is actually harm themselves. So, and what is the best actually treatment available for them. So this is what the modalities that we can actually do for this kind of person. Usually depression is the highest patient that can develop heart attack.
Okay, now could you share with us, Dr. Iskandar, some of your personal experiences where your patients have gone through heart disease and depression or anxiety, and how you and perhaps IJN have helped them in terms of dealing with this?
Okay, so a good thing about IJN is we have a lot of multidisciplinary team. So we have a few patients actually have actually work-related stress. Actually, when actually quite young, is a 45 years old gentleman. Actually, no medical illness, no diabetic, no hypertension, and then the cholesterol actually a bit mildly elevated. So came in with a heart attack. So what happened is actually we did an angioplasty. We managed to open the block vessel at the heart. So and then on further assessment after the procedure, we noted that actually patient in the low mood. Every time I come and see the patient, he don't have this eye contact. This is one red flag, the first red flag that we can notice. No eye contact, and then when I ask question, the answer will be only one single answer only. So don't like to elaborate more regarding his condition. So what we do is actually, as we settle the heart attack, the blockage of the blood vessel, so what we do is actually we will refer to psychologists first. So we have here in IJN, we have psychologists, few psychologists. So when the psychologist assess actually the patient is really in low mood and possible to have depression. So from there, actually we did refer to psychiatrists. Before the patient was discharged, was seen by psychiatrists and started on medication. He was started on medication and given long MC, medical leave. So and then good thing is I managed to see him back in the clinic after 3 months after we do procedure, and he is more happier than now. Actually during the clinic review after 3 months now, actually he talked a lot. He said that actually what he started smoking. Actually he has a stress, work-related stress. Because now everything, because of COVID, most of the work down is a work from home. So when you do work from home, it's not as easy as working at the office, because at home you have family. So every time you do your work, actually the kids actually keep on coming to him. So the work become disrupted. He can't concentrate to work, and then because of that, another day he start to smoke at home, start smoking, and then also start to drink a lot of alcohol, taking a lot of alcohol. So because of that, I think one of the main reason that actually he's having a heart attack during that time. The only other factor that can lead is a bit elevated cholesterol level for him. So that is my personal question that I see in IJN.
I see. Now, Dr. Iskandar, you mentioned an interesting thing about how IJN helps, obviously, post-operative. Now, I noticed there was an escalation. You first referred to a psychologist, and then after that, a psychiatrist.
Yes.
Is that the right first step to take, and first go to a psychologist?
Yes, sometimes actually psychologists, they can assess a patient whether they have this alarming sign that need to refer to a psychiatrist. Okay, so that's why actually the first step is supposed to be a psychologist first, and then the psychologist will actually inform us whether the patient need further intervention. Means that we need to refer to higher authority such as a psychiatrist.
Okay, and also I want to ask you, the role of the family is also a very vital role in terms of recovery, either from the physical operation, but also from the mental aspects of the operation, as we've discussed, depression, anxiety, and so forth. Could you walk us through some of the things that your experiences have been, and how perhaps you as a doctor or IJN or interact with the families to ensure better outcomes for the patient post-operation?
Oh yeah. Okay. Here, just want to share with you, Brian, that our operation, like bypass, we do a cardiac key bypass graft that we do here is the outcome is very good. We have a very dedicated and also experienced surgeon here in IJN. So most of the patient have a very good prognosis. The recovery is very good. So what we do actually before they went to the surgeon, they will go to us first. They will come with heart attack. So what we do is we do angiogram, and then we see how many blockage at the vessel of the heart. So if there's more than two or three, we will call actually we will consult our surgeon whether they can do a bypass for them or not. If they can't do or the blockage is very minimal, we can try to open it using stent or balloon. And then before we do everything, actually we will call the family, so the family always be informed, understand actually what going to be done to the patient. And then after the procedure also, we will inform the patient family so that they understand that the outcome of the surgery or the procedure that we done to the patient. And then afterwards, of course, actually we here because of COVID, actually the limitation that we have now is to do a family conference. Usually, previously, every procedure that we do, actually we call all the family members to come and we sit in a room so that we tell the pro and cons of the procedure. Okay. But because of the limitation of the COVID now, actually what we do is we call them so by phone so that they understand how the procedure is, and also we inform after the procedure. So far, actually, most of the patient actually and also the families are quite happy the way that we interact with them, because the more that you interact with them, the more they understand more about the problems. And then because of that, actually the patient and also the family members understand the outcome afterwards. If anything happen, also they know what's complication that can happen after that. So they become more open. It's very easy. Even if we have complications, so they understand why the complication happened. So they don't get angry or dissatisfied with the treatment that given by us. But so far, actually, if you ask me, all the outcomes that the patient that I referred to the cardiothoracic team, the surgeon, actually the outcome is very good so far.
Now, given this scenario now, so obviously that is very well taken care of in an IGN perspective. But if we take a step back, Dr. Iskandar, what are some of the tips that you would be able to give us in order to make sure that we have good mental health?
Okay, so first we need to minimize our continuous stress. We set priorities for what is most important to you, and also to aim for life-work balance. So we have to make time for family, friends, and also laughter. We have to ease stress and improve mood through physical activity. By increasing your physical activity, your endorphin hormone will be increased. That's why for those who exercise regularly, actually they always have this positive vibe, if you notice it. And then regular exercise also helps to lower blood pressure and combats other cardiovascular disease risk factors. And then also mindful meditation and deep breathing can help manage stress. You can also consider yoga, actually, which combines movement, control breathing, and also relaxation. Okay. And then that one is also a good technique. Another thing is sleep. Sleeps are very important. Sleep and stress are interconnected. Stress can affect sleep, and lack of sleep can in turn lead to stress. So you need at least 7 to 8 hours of sleep per night. So better sleep hygiene is critical in management of stress and also promotion of heart health. Sleep, better for sleep hygiene is you need to sleep in a cool, dark, and quiet room. And then
cool, dark, and
quiet room.
Quiet room. Okay.
So actually, the best way, Brian, you cannot have television in your room. Okay, bedroom. It's the best way actually. Actually, when you have television, actually it will actually affect your sleeps. And then make sure that you don't watch your phone. Use your phone before sleep. This also going to affect your sleep.
Okay.
And then don't exercise close to bedtime because that time your adrenaline will be pumped up. Then that it will makes you difficult to sleep at night.
Okay.
Avoid eating or drinking in the hours before bedtime, especially alcohol and food high in fat or sugar. If you have this, you eat just before you sleep, actually the sugar control will be high and your brain start to think a lot. So that's why it's also difficult for you to sleep. when you
Okay.
eat before sleep. This is very difficult. Okay. So this is my tips lah. How to reduce the stress, and also for unending stress or symptoms of depression, talk with healthcare provider about getting help. You can go to anyone. Actually, we have a good psychiatrist in Malaysia or psychologist. We have a good team here, so they can help you. Don't worry. If you are afraid to talk to them, you just inform us first. We also can actually tell them that you need help.
Dr. Iskandar, it's been a fascinating conversation, very informative, especially on various aspects of how to deal with depression, anxiety, and also the last bit where I think I learned some new tips on how to sleep better. But before we leave, Dr. Iskandar, any final thoughts you would like to share with us?
Okay, so adopting some degree of serenity in the face of life is a challenge, life challenge. So it may improve the perception of stress and result in better quality of life and better cardiovascular health. So it's good that if you can actually control your stress. If you think that your stress unable to be controlled by sharing with others, like your family, friends, or doing other things, meditation, exercise, please seek help. Because why? Once you go into depression, it's very difficult to be treated. Because that's why for those who have depression, they can have relapse. When you have relapse, you can't function properly. It can affect your family, it can affect your job. We don't want that to be happen, because now the economy also not that good. So when you lose your job, it will further causing further depression to you. So if you have any symptom, unending stress, just inform the healthcare worker. We will help you. No, don't worry. Because why? Because once you have depression, it's very difficult to treat. That's the message that I want to tell to you guys, all of you.
Dr. Iskandar, thank you very much for taking the time to be on the show.
You're welcome, Brian.
Now, I'm Brian Fernandez, and we've been speaking to Dr. Iskandar Mirza Shafie, the Clinical Fellow of Cardiology at the Institut Jantung Negara, the National Heart Institute of Malaysia. Now, on BizTech's Health and Wellness Show, presented by Institut Jantung Negara, which is the National Heart Institute of Malaysia. This video will be on our various social media platforms, as well as our website, www.biztech.asia. Please subscribe and like our various platforms. Thank you very much for tuning in.